The first question is regarding preoperative fasting. Which of the following statements about preoperative fasting are true? So now it's going to be an interactive session. We are going to be answering the question true or false. Which of the following statements about preoperative fasting is true? A clear fluid are allowed up to 2 hours before surgery. True or false? A clear fluid are allowed up to 2 hours before surgery. You should all unmute your mic, please.
False, sir.
False.
Okay? So
False, sir.
you have to tell us the reason. The clear fluid are allowed up to 2 hours before surgery. True or false?
False, sir.
Why do you say false?
The normal fasting time for a patient going for a surgery, especially the elective surgery, is usually 6 to 8 hours. So for even a clear fluid to be up to 2 hours, yes, due to the normal.
Yes, I can hear you. Your network is going up.
Just to avoid registration and aspiration of fluid that is taking place.
But you know that the normal gastric emptying time for clear fluid
4 hours. Before. It's how many hours, sir?
I know the normal. What is the normal gastric emptying time?
I think it's 4 hours.
Okay, what of clear fluid?
That I'm not sure.
Okay, you should know that clear fluid, okay, for clear fluid is allowed. You can take clear fluid for up to 2 hours. Okay?
Okay.
You understand? For solid food is 6 hours. For cow milk, milk is regarded 6 hours also, because when it combines with acid, it forms solid curds. Okay? Breast milk is 3 hours. Clear fluid, what? 2 hours. Clear
2 hours.
Yes. Now B says cow and formula milk are allowed up to 3 hours before surgery.
And that will be false.
That will be false, sir, based on your explanation.
Okay, this is false because you know cow milk usually in the stomach, when they combine with acid, they form curd-like solid. And you also consider cow milk as solid. Okay, so that is false. Pain, opiates, and trauma increase gastric emptying time. Pain, opiates, and trauma increase gastric emptying time. True or false?
I think false.
False, sir.
False.
No, it's true.
So everybody should explain his reason now.
I think false because in cases of trauma, they're trying to go into sympathetic activities, and that divert gastric emptying is not an emergency, or rather, I think that's my reason saying false.
Okay.
So
So
it divert to vital organs during trauma and pain.
okay.
And gastric emptying, maybe parasympathetic.
So pain, opioids, trauma, they all cause a reduction in gastric emptying time. Okay. Do they cause reduction or increase?
Increase, sir.
So our answer is here, true or false?
True.
So our answer is true. Hiatus hernia increased risk of aspiration.
Sorry, sir, I didn't hear the explanation.
Sorry, sir.
What was the explanation for person?
I also need an explanation for this.
Okay. They said pain, opioids, and trauma increases gastric emptying time. Now, what is the effect of parasympathetic stimulation of the stomach, the muscle, and the sphincter? And what is the effect of sympathetic stimulation, adrenaline, on the stomach, muscle, and the sphincter? Yes.
So,
Relaxation.
What do you say?
so let me attempt.
Okay.
The parasympathetic nervous system increases peristalsis by encouraging us the muscles to contract. Then it also opens up the sphincters. So somebody is more likely to have bowel movement when it's at ease. So anytime we have any pain, trauma, now the sympathetic nervous system comes in. So it does the opposite of what the parasympathetic does. Now it constricts the sphincters and then reduces gastric and GIT motility. So that will increase the transit time for whatever is in GIT.
Okay. Yes.
That's awesome.
You are right. So our answer here is what?
True.
Hiatus hernia increase the risk of aspiration. True or false?
True.
True.
Okay. Why is that so, please?
So it interferes with the lower esophageal sphincter. So
Yes.
it makes it incompetent.
Yes, hiatus hernia makes the lower esophageal sphincter incompetent, and there's high risk of reflux. Okay, so factors like dysfunctional gastroesophageal sphincter, hiatus hernia, pregnancy, they all cause relaxation of the sphincter. Routine medication can be given within 2 hours of surgery. True or false? Routine medication can be given within 2 hours of surgery. True or false? Are you
True,
am I alone?
No, sir. No, sir.
Yeah, no, sir. I still go with false. Routine medication.
Yes.
Within 2 hours of surgery. That means post-operatively. If it's within our. Okay, I think.
Pre-operative fasting is the question.
Pre-operative. Look at the question. Pre-operative.
I think true.
Sorry. True, sir.
Yes. Well, you take precaution of giving with a small amount of water. Like hypertensive patient, you can still give them their morning dose, but with a small amount of water. Okay. Which of the following drugs will cause derangement of a standard coagulation screen? Which of the following drugs will cause derangement of a standard coagulation screen? A, low molecular weight heparin. B, unfractionated heparin. C, clopidogrel. D, warfarin. E, aspirin. Yes, you are all quiet.
Sorry, you all look through, sir.
So you mean
This is also true.
We're
I think
digesting this question.
A is false. A is false.
A is
A
false.
is false. A is false.
The Clexane we use routinely, does it cause
Yes, sir.
management
Yes,
of
sir.
standard coagulation screening?
You also B.
Hello? You said?
Sir?
Does Clexane cause
No,
derangement of standard?
no, sir.
Okay,
No, sir.
false.
No, sir.
So B, unfractionated heparin.
Also think it's false.
Unfractionated heparin, they actually inhibit antithrombin 3, okay?
Okay.
Inhibit factor 2, activated factor 10. So they interfere with the activated
Coagulation.
thromboplastin 9. So this one is true.
Okay.
What of C?
It's
Clopidogrel.
also an antiplatelet. So I think
Does it interfere with the routine coagulation screening?
False.
It's
No.
false because platelet,
It's-
what does it interfere with? Platelet,
Coagulation.
coagulation too, sir.
no,
Bleeding time.
bleeding time.
Breathing time.
Bleeding
Okay.
time.
Because they form what? Temporal hemostatic.
Clog.
Yeah.
Clogs.
Yes.
So platelets
Mm.
actually evaluate bleeding time. Okay. D, warfarin. Warfarin.
True.
True, sir. With long time.
Warfarin. Okay. What does warfarin do? Warfarin interfere with vitamin K.
Yes.
Interference of vitamin K dependent clotting factors.
Time.
Yes,
Okay.
and this will interfere with standard coagulation screening. What of aspirin?
False, sir.
False.
Yes. Aspirin does not interfere with standard. What does it inhibit?
Platelet
Also
aggregation.
platelet aggregation.
Yes. Which of the following factors increases the likelihood of difficulty obtaining and securing airway under anesthesia? A, obesity,
True.
True.
because they have short neck.
Narrow.
But not.
Narrow and short.
B, dentures.
Yes.
False.
True, sir.
Hmm?
False.
True, sir.
Somebody,
False. I think that's
somebody say true. Which one? Now, this to draw your attention, every anesthetist will ask a patient whether there is dentures. If there are
yes,
dentures,
sir.
remove them and keep. You not say, okay, there are dentures, let me be careful. So it's not expected to cause any difficulty, okay, in obtaining and securing airway under, because you just remove the dentures and keep them. Is that not
Yes,
so?
sir.
So
Yes,
this-
Yes.
C, reduce neck movements. Yes, if patient have,
prior to neck, you mean neck injury or cervical injury?
I didn't, they said reduce neck movements. They did not mention cervical injury here. Just the way.
No, sir. Just as the neck is the reduced movement is.
No, the way the question is, that is the way you answer it.
True. Reduce the movement is
True.
true.
Because if somebody have, what can cause reduce? If you want to intubate, what will you do? Don't
You have hyperextend
hyperextend the neck? And if there is difficulty in hyperextending due to cervical spondylosis, there will be difficult intubation. So this is true.
Yes, sir.
Malampati, grade 1 and 2.
False.
False.
Okay.
False.
2. Maybe 4 and 3.
Yes. Previous radiotherapy of the neck.
True.
Yes. Because what would radiotherapy cause?
Stricture.
Stricture of what?
Fibrosis. Maybe
Fibrosis. That's the.
I was thinking there's urethra in the neck now. So there's
stenosis.
Fibrosis of tissues around the trachea. Tracheal fibrosis and narrowing.
Yes, they will become hard,
constriction,
inflexible. So this one is true. With regards to pre-operative investigations prior to elective surgery, which of the following statements are true? A, pre-operative chest x-rays are routinely required in patients with chronic obstructive pulmonary disease. True or false?
True. True, sir. True.
They said
true.
With regard pre-operative investigations prior to elective surgery, which of the following statements are true? Okay. Pre-operative chest X-ray are routinely required.
So false, sir.
Is it always required?
No,
because it will not change anything and it will not give any idea of changing on the surgery. So, maybe lung function can be used.
Lung function test with COPD.
So the chest X-ray will not actually determine the respiratory. Sorry, the chest X-ray will not determine the respiratory function of patients. Okay, so it's not routinely per se. A full blood count is routinely required in all patients.
True.
True.
All patients.
False, sir.
False.
False.
This is elective.
It's false because especially in emergency, elective.
Elective surgeries.
No, it's still false. It's still false. There are minor surgeries that don't require full blood count.
Yes, there are some minor surgeries that are elective now. They don't require.
Yes, but they don't require. Yes, sir.
Don't require full blood count. An ejection fraction of less than 30% on echocardiography is associated with an increased risk of preoperative mortality. True or false?
True. 30%. I thought 60%. Okay.
30%. That's low.
It's low. Any ejection fraction that is less than 50. Okay.
50. Okay.
Don't accept any ejection fraction that is less than 50.
50. Okay.
Less than 50, you are in trouble. Okay.
True.
So, patients over the age of 60 should usually have ECG performed pre-operatively.
True.
Yes, it's true.
True, sir.
The answer is true. So
we're not taking the answers. We're not taking the answers, sir.
Okay, I'll send you.
False, true.
Okay.
The answers are in the note section of the slides. Okay.
Okay.
Which of the following is a problem associated with surgery in the obese patient? A, deep venous thrombosis.
True.
Pressure source.
False.
True, sir.
True.
It's
True.
Because
of the weight.
yes,
Yes.
mechanical.
True.
Post-operative respiratory failure.
True,
know-
sir. Because
Also
they are frequently associated with apnea,
Yes.
especially sleep apneas. Yes, too. Yes, sir.
Why? Because of the way
Yeah, still the
Because
weight,
of the
the weight.
yes.
Yes, sir.
Control.
Mm.
Pain control.
True.
True.
Why?
False.
They require higher dose. So if
Higher doses of analgesia.
you give them the routine dose and you feel as if it's sufficient for them, but of
Okay.
not. So let's take a break here. Pray, then we'll come back and continue.
So what time, sir?
Okay.
I'll come back.
Let's say
15 minutes. as usual.
Okay.
7, yes.
Okay.
Thank you, sir.
Okay, we are going to continue from where we stopped. Now we've answered this question. Okay, the next question is regarding consent for surgery. Which of the following statements are true? A, Jehovah's Witness will never accept blood transfusion. True or false? Are we together?
Yes, sir.
Yes, sir.
Yes. What is our answer?
Generally true.
True, sir.
Jehovah's Witness will never accept blood transfusion. True or false?
False. Some of them accept though.
Sir, true.
Is it all forms of Jehovah's Witness that do not accept blood transfusion?
Some of them accept.
Accept blood transfusion.
So, yeah, I've not heard of any, sir. And I don't even know how many categories there are, but I know that almost all of them don't accept. As a matter of
Some
fact, sometimes
accept,
even if you
but
give,
they say transfuse me intra-op and don't let my family know.
okay.
Oh,
Yeah,
that
some.
is not a category.
Because I know some, even after even in emergency, you're able to transfuse, it's going to cause a lot of problem for you.
Yeah.
Even after you transfuse them and save their life, then they will have to
They will
question
do
why
it.
you have to transfuse them. Yes. So I think it's, to me, no, it's false. Yes, true. Okay, sorry, sir.
So Jehovah's Witness, there are two types. There are two categories. There are some that do not accept blood and its products. I believe that as long as blood or its products goes out of someone's vein, it shouldn't be transfused because they believe that blood is life and it's only God that gives life. So they do not accept any forms of transfusion. But there are some other category that will accept blood products. So that makes this option false because
Okay.
transfusion is infusion of blood or its products. Okay. And
Yes,
don't,
sir. Thank you.
they will not accept. You have to ask them. And when they accept, they consent, then you now know these are the types that will accept some products. So this answer here is false. Okay. It can be assumed. It can be assumed that a patient with a mental illness will not have the capacity to give informed consent. True or false?
True.
Yeah. As
True,
far
sir.
as there's alteration in the mental,
Mentation.
yes, you cannot give consent. Okay, you have to preclude any person with mental illness because they lack capacity. If you give consent for a mental illness, that consent is invalid. It's an invalid consent. So all treatment options, including doing nothing, should be discussed. True or false? All treatment, yes, including do nothing. False.
Yes, sir. So what about the mastering inactivity that you said?
You also tell them that you're mastering, you're not going to do anything, or doing something will complicate that.
Then it's no more mastering inactivity.
No, it's a form of treatment
But
now.
actually,
Masterly inactivity is a treatment. You inform the patient that this patient, you won't do anything because if you do something, he may die. Okay?
okay. So true, sir.
Yes. So D. Children under the age of 16 can never give consent. True or false?
So true.
They cannot give consent. So what do they give?
I think the caregiver will give the consent.
So what is that called?
Proxy.
It's called
Guardian.
assets.
Asset.
When E, all complication with an incidence of 1% should be discussed with the patient. True or false?
True.
Sorry, for the option D, sir. So they can give consent. That's what you said, sir.
Yes, they can give consent.
Okay.
Is together with their caregiver or guardian. Okay. And that is called their form of consent is called assent. Okay, where they are signed for by their caregivers.
Okay, sir. But in the concept of consent, sir, I thought is the okay. I get it. I got it.
All complication, we said this is what? True. Which of the following statements regarding pre-operative preparation prior to elective surgery is true? Prior to elective surgery is true. Hormone replacement therapy should be stopped 6 weeks prior to surgery. True or false? Hormone replacement therapy should be stopped 6 weeks prior to surgery. True or false?
I'm not sure of this.
Hormone replacement therapy have a risk of causing trauma.
Yes,
so
sir.
you want to stop
Okay.
before surgery. Okay. So your answer is true here.
All right. Thank you, sir.
Elective surgery should be postponed for 6 weeks following a respiratory tract infection.
True, sir.
Yes, because they have a risk of developing, they have risk of respiratory complications, excessive secretions. Okay, so they have risk of
Yes, sir.
respiratory complications. So you have to postpone an elective surgery for 6 weeks. A patient taking 5 grams of prednisolone will require perioperative steroid supplementation. True or false?
True, sir.
True, sir.
Okay, it's false. Why is it false? It's the dosage.
Okay.
5 milligram.
Steroid supplementation is required in patients taking more than 10 milligrams, okay, per day for 3 months before an operation. Is the
Okay. Okay, sir.
10 milligrams here. Patient with body mass index of less than 15 has a significant increased risk of hospital mortality, BMI of less than 15. True or false?
Yes, sir. It's
Why?
true, sir.
Why?
Because they have they are underweight, sir.
Okay. What will happen to underweight patient that undergo major surgery? They have high risk of infection, high risk
They
of
have high risk.
breakdown, and
Yes, sir.
leakage. Okay.
Yeah, due to decreased albumin and protein synthesis, and
Yes.
also
Even their
yes, sir.
respiratory muscles and so on. So they
Yes,
have
sir.
high risk of mortality. Patients
True.
with hemoglobin of 8 should be transfused prior to surgery.
Yes, sir.
True. True, sir.
What is transfusion trigger? Who can define transfusion trigger? Yes. Transfusion trigger is the hemoglobin level, okay, which a patient need to be transfused, okay? Below that, a patient needs to be transfused. And transfusion trigger is 9 grams per DL for patients with cardiovascular disease and 7 grams per DL for patients with without the disease. Okay, usually this is more of academics. It is shown that patient with 8 grams per DL, there is no actually affectation of their wound healing, but less than 8 should have transfusion. But routinely, our optimal PCV before surgery is 30 grams. That is HB of 10 grams per DL. But of course,
Yes, sir.
WHO standard, the transfusion trigger is less than or equal to 7 grams per DL. So in case of exams, when you see questions like this, it's false.
Yes, sir. Yes, sir.
When it's less than 7 in patient with cardiovascular disease. Is it clear? That is the WHO
Yes, sir.
standard. Of course, we don't. So, regarding patients with diabetics undergoing surgery, which of the following statement is true? Regarding patients with diabetics undergoing surgery, which of the following statements are true? A, tight glucose control is recommended to prevent infection. True or false?
True.
tight glucose control
False.
is recommended to prevent infection.
True.
True or false?
True.
Sir. Okay.
Yes.
Go contrary, sir. I think.
Why do you say true?
If the glucose is left uncontrolled, it will affect the ability of the leukocytes to do their job. What is called lazy leukocyte syndrome.
Okay.
So the phagocytosis will be affected. Also, the release of some cytokines will be affected. So infection is more likely if the sugar is not controlled.
What do you call tight glucose control? Tight, when you see tight, between 6.1. Okay, you want to make it not to go beyond this range. That is tight glucose control. But of course, you know, patients that come with diabetes mellitus, you have to optimize their glucose to some certain level. If they come with an emergency, you have to bring the glucose down to about 12 to 14 before they are now placed on GKI, okay? And you control. Of course, it is recommended to prevent infection, but however, it is no longer recommended because of most of these patients go into risk of hypoglycemia. Of course, good glycemic control is required, but the tight glycemic control, you don't want it to go above 6.1, not less than 4.4. It's good to prevent infection, but it's no longer a recommendation because of the risk of hypoglycemia. It doesn't mean you won't control. What we are talking about is tight glycemic control, and you restrict it within that level. Okay, you don't want patient to go into hypoglycemia. You don't want patient to go into hyperglycemia. So our first option here is false. Of course, you see why people don't get 100% in MCQ. This is this type of questions. Diabetic patients should be prioritized on the theater list.
True.
True, sir.
True.
Yes, true. You don't want to fast them for a very long time. Diabetic patients have an increased risk of cardiac events.
True.
True.
Okay.
True, sir.
Yes, they have increased risk of cardiovascular and even peripheral complications. Now, glycated hemoglobin reflects glucose control over a preceding 8 to 12 weeks. True or false?
True.
Yes, so
True, sir.
glycemic
True.
hemoglobin, that is what you use to measure compliance.
Chronicity.
Yes.
Yes.
So poor wound healing is more common in diabetic patients. True or false?
True.
True, sir.
Okay. Which of the following is a risk factor for thrombosis? A, pregnancy. B, young age. C, smoking. D, trauma. E, malignancy.
A, sir.
Explain your answer. Thrombosis, risk factor for thrombosis. Yes, we are waiting.
Sir, A can also be a risk factor for thrombosis, and also C Can be a risk
True or
factor.
false now? Which of the
A,
following
sir.
is a risk factor? True or false? A, true or false?
True.
Okay. A is true.
A is true, of course.
Yes.
B,
False.
False. False.
C,
True.
C is true, sir.
D,
True.
It's true, sir.
E.
It's also true, sir.
So you know, you remember the virtuous triad, okay? What are the triad? Can you tell us the triad?
Hypercoagulability.
Hypercoagulability. Yes.
Is it stasis? Stasis.
And endothelial
And
injury.
endothelial damage, sir.
Yes. So now, how does pregnancy causes increased risk of thrombosis? Yes. You know, when in the gravid uterus, there will be edema of the lower limbs and stasis. Is that not so?
Yes, sir.
So there is stasis there, and they have risk of developing DVT because the gravid uterus will be compressing of the veins of the lower limb. Young age, of course, is not a risk factor for DVT. Smoking causes endothelial injury. Trauma causes endothelial injury. Malignancy also causes hypercoagulability, stasis, and endothelial injury. Okay. Which of the following statements about management of high-risk patients are true? High-risk patients. Okay. All patients undergoing major surgery should be started on beta blocker on the day of surgery. True or false?
False.
Why is it false?
So there
Some
must be
patients are already with impaired cardiac function, and you can't further depress them with the beta blockers.
They say all patients. All patients.
So there must be an indication for the beta blocker.
Yeah, an
You
indication.
don't just give everybody. So if the patient doesn't meet the indication,
So it's false. So A is false. B, long-term beta blockers can be safely withheld on the day of surgery. True or false?
false.
False.
Why?
If it's a long-term beta blocker, that means its effects will span a long time, even before the surgery and then after the surgery. So it will be better to stop it some months to the surgery, to take away the effect, and then use another maybe safe drug to replace it.
So long-term beta blocker, you don't even stop them. Because stopping them will increase the mortality. Okay.
Yes.
In the patients. The esophageal Doppler accurately measures cardiac output. True or false? Adequately measures cardiac output. True or false? What does it do?
Measures blood flow.
Esophageal Doppler, okay, accurately measures cardiac So it's false. It cannot give you the accurate measurements of the quantity. It measures the flow of blood. Okay.
Yes, sir.
Better fluid management can reduce post-operative ileus after abdominal surgery. True or false?
True, sir.
Yes, if you overload patient with fluid in the post-operative period, you have paralytic ileus. So you have to be very cautious of your fluid administration. So edema of the intestine will reduce the motility and they will have prolonged post-operative ileus. Early return of enteric feeding is associated with reduced hospital stay. True or false?
True.
So you have only two, true, D and E. So this is the